How does pleural pressure cause lung expansion? Imagine your lungs as balloons inside your chest that need just the right pull to fill with air. The secret behind this process lies in something called pleural pressure. Pleural pressure is the pressure inside the tiny space between the lung surface and the chest wall. This space is filled with a small amount of fluid, making it a thin, slippery gap. Normally, the pressure here is lower than the air outside your body, which is called negative pressure. This negative pressure acts like a gentle suction that keeps your lungs glued to your chest and prevents them from collapsing. At rest, your lungs tend to recoil inward because of their elastic tissue, like a stretched rubber been wanting to snap back. Meanwhile, your chest naturally wants to move outward, like a balloon trying to expand. These opposing forces create a balance, making the pleural space pressure more negative than the air outside. When you breathe in, your respiratory muscles, mainly your diaphragm and the muscles between your ribs, contract. This causes your chest to expand outward and your diaphragm to move downward. As your chest cavity gets bigger, the volume of the pleural space increases. According to Boyle's law, when volume goes up, pressure goes down. So the pleural pressure becomes even more negative. This more negative pleural pressure increases the difference between the pressure inside your lungs and outside. This difference is called transpulmonary pressure. Think of it as the force that pulls your lungs outward. When transpulmonary pressure rises, your elastic lung tissue stretches and the lungs expand to fill the larger space. As your lungs expand, the pressure inside the alveoli, which are tiny air sacs in your lungs, drops slightly below the atmospheric pressure outside. This pressure difference causes air to flow into your lungs. The air continues to flow until the pressure inside the alveoli equals the outside air pressure, stopping the airflow. How easily your lungs expand depends on their compliance or how stretchy they are. More compliant lungs stretch easily with small changes in pressure, while stiffer lungs need larger changes in pleural pressure to expand. In simple terms, pleural pressure causes lung expansion by creating a negative environment around the lungs. When this pressure becomes more negative during breathing, it pulls the lungs outward, stretching them and allowing air to come in. If air or fluid leaks into the pleural space, the pressure becomes less negative or positive, which can cause the lungs to collapse and make breathing difficult. Understanding this process helps doctors manage conditions like pneumothorax or pleural effusion and supports treatments like chest tubes or mechanical ventilation.